Hi, everybody, and welcome back. I'm Amy Davis, clinical psychologist at Montana Spine and Pain, and it is my pleasure to host conversation number 5 in our Understanding Pain series. And this one is on sleep and diet. So I thought, at this point, hopefully, if you've watched so far, or maybe you're watching out of order, I wouldn't know. But if you watched so far, I thought, gosh, maybe I should have a variety of shirts or a different disguise or, some sort of different fun accent for you. But, the fact of the matter is that hopefully this class is for you. So this would be the point in the class that I would want you to pull out any questions that we had from last time, and how your functional goals are going and how your sims are doing. So you might take a moment and really look and see, especially if you've kept notes, if the questions that you have had, if any of them have been answered or resolved, if there's other things you'd like to know more about, and how you did last time after our class on stress. Are you thinking about your stress response as a protector, right? How's your self-compassion? Are you checking in with your body and scanning and breathing? Okay. Speaking of breathing, I'm going to share my screen here because we are going to begin with another quieting exercise. And there we go. And I'm very excited about this one because this one is a Jon Kabat-Zinn from his very wonderful series. He has specific mindfulness meditation CDs. Wow, we're going back in time there. We're almost talking, 8-track tapes, but actual CDs, which I use, by the way, CDs and MP3 downloads, mindfulness meditation, and many, many wonderful books on mindfulness meditation, and mindfulness meditation specifically for pain. And these are so, so helpful. So without further ado, I'm going to invite all of us to get comfortable in our chair. And this is about a 10.5-minute section of an introduction from Jon Kabat-Zinn, mindfulness meditation for pain relief.
This is the checkers game where grandson and granddad will bond.
Sounds True presents Mindfulness Meditation for Pain Relief, Guided Practices for Reclaiming Your Body and Your Life, with the founder of the Stress Reduction Clinic at the University of Massachusetts Medical Center, Jon Kabat-Zinn.
Let's take a moment and just tune into how things are for you right now. Since you are already playing this introduction to the program, obviously you are ready for something. So let's just see what it might be like to drop into this moment as it is, however it is, with full awareness. Together, you in your experience and me in mine. First of all, can you notice the sound of my voice as I'm speaking? And the sound and feeling inside yourself of silence and wakefulness when I stop talking, or even underneath my talking. Can you notice any other sounds that may be coming to your ears as I stop speaking? Sounds in the room, from outside, from nature, whatever they are. Can you experiment with just being aware of them for a moment or two as sounds, not even naming them or wondering about their source? And can you also be aware of the air that is bringing them to your ears? The air around your body, the air that you're breathing. What about your breathing? Can you notice that? The feeling of the air coming into your body and leaving your body with every in-breath and out-breath. Can you feel the breath sensations in your body with this in-breath, with this out-breath? What about a sense of your whole body? Can you be aware of your whole body sitting here or lying here, breathing? Just seeing if that is possible, without even trying, just by noticing. Aware of the entirety of the body sitting or lying here, breathing. Now, can you single out one place or region in your body that is not hurting at all in this moment? And if so, just seeing if you can be aware of how it feels, of the sensations in that region, maybe along with the feeling of your breathing. And can you be aware now of one place in your body that is hurting at the moment? Even for the briefest of moments, can you turn toward that place and the intensity of the sensations with even the tiniest bit of openness? Just a peek, a quick toe in the water, and then out. What was that like? How is it right now in the aftermath of turning toward pain or discomfort? If you were able to bring awareness to any of those aspects of your experience for even the briefest of moments, and just feel whatever you were able to feel, you are already well on your way to developing a new and potentially healing relationship with your pain, and even more importantly, with your own mind and body. And if you found that brief exercise to be challenging and not very satisfying or even promising in this moment, well, that is exactly why this program in mindfulness meditation for pain relief contains a whole set of guided exercises that you can work with to develop and deepen your natural born ability to find new ways of being in relationship to pain and suffering, and a new freedom to live your life with greater quality and ease. If you are listening to this program, the chances are that your life is in some way or other shaped by pain and the suffering, both physical and emotional, that usually comes along with it. If so, here are two things you might want to strongly keep in mind from the very beginning of our work together. One, you are not alone. And two, learning to live with pain that will not easily abate or go away is possible. Tens, if not hundreds of thousands of people have discovered that living with pain is a process, a minuet of sorts, maybe not to the tune you would have chosen if you were entirely in charge of how things unfolded in your life, but nevertheless workable in some wonderful and very freeing ways, especially if you are willing to do a certain amount of work yourself. And good news, there's no one right way to do this work. There's no cookbook recipe, no one size fits all. Everybody is unique, and everybody ultimately finds their own way to live and live well in the face of the difficult, the challenging, and the unwanted that arises for all of us sooner or later in this life. So your unique experience, including the particular difficulties you face and have to work with, become part of the work of mindfulness itself, rather than being obstacles to being mindful and the pain relief that mindfulness can lead to. With this attitude, there is no way to fail, really, because we're not trying to force anything to be other than it is. Only hold it in awareness. Out of that, the pain and our relationship to it can change profoundly. There is convincing evidence from pain studies that the greater the intensity of the distressing sensations, the more awareness strategies are beneficial and the less distraction strategies are effective in bringing relief. Tuning in trumps tuning out. World-class endurance athletes, for instance, know this intimately and tend to monitor their body's sensory experience moment by moment during training and competition. Our clinical evidence suggests that the same is true for medical patients with chronic pain conditions. If you are listening now, in all likelihood, you are very much ready and motivated to do this work. Perhaps because the other options you have tried have only been beneficial to a degree, if at all, and the pain is still seriously eroding the quality of your life. I use the word work, but in actuality, mindfulness is as much play as it is work. It is a throwing yourself into the dance, whether the music is always of your choosing or not, as something of an experiment, an adventure in reclaiming your life to whatever degree is possible. And we cannot know what is possible unless we throw ourselves into the process as wholeheartedly as we can in any given moment and give it and ourselves a fair chance, and then see what happens. We will be learning from life, and one of the things that we will be learning and experimenting with is that even the pain itself, perhaps what we sometimes feel is our worst enemy, can eventually become our teacher and ultimately our ally and friend.
Okay, so the world-renowned Jon Kabat-Zinn, who has done a tremendous amount of work in bringing mindfulness meditation to the awareness of people in this country, and specifically mindfulness meditation for pain. So I would encourage you, if you liked what you heard or like the sound of his voice or want to know more than just the brief introduction, that you look at his stuff online. The downloads of all of those different mindfulness exercises are fairly affordable, and the CDs even more so, because I think you can get them used. So welcome back. We are talking about sleep and diet and how those two intersperse with pain and interact with pain, and how pain affects them both and vice versa. And we will start with sleep and see if this particular cartoon is anything that you can relate to. And humor aside, I think even before my time at Spine and Pain, I'm aware that poor sleep or sleep deprivation is probably one of the most pervasive, serious, health conditions that affects mental health and physical health in the country. And if I were to describe, our whole country as a person right now, probably for about the last, 10 years, I would say anxious, stressed, and sleep deprived. And that was before the pandemic. So, the importance of sleep is so fundamental to who and what we are, what we do, how we think, how we feel. It is just absolutely one of the cornerstones of mental and physical health. And then we'll talk about diet and food. Again, within my scope of practice, I'm not a nutritionist or a dietitian. I'm a psychologist who has learned a lot about health psychology and how that works. But some of the specific questions that you may have about vitamins, supplements, diets, etc., are best answered by a nutritionist, a dietitian, or our clinical pain pharmacist. I should point out that Dr. Hobbs is not only a clinical pain pharmacist, she's also a health coach and has had additional training in nutrition, dietary supplements, etc. So talking to somebody who knows specifically about macro and micronutrients, I think is helpful. But we'll have a general discussion about it. We do, however, know a lot about the emotional, cognitive, and physical benefits of sleep, how sleep and pain interact together, and what can interfere with good, healthy sleep, and then what to do about it. It's actually a very important piece of many different professions. Health psychology, certainly one of them. Overall primary care. There is, in fact, a wonderful physician assistant at Providence, Scott Green, I think is his name. I hope I didn't mess that up. Who specifically works with sleep-focused cognitive behavioral therapy, because it's so important that people be able to have good, healthful sleep. And of course, the fact that we have a sleep medicine department here at Providence Hospital speaks to the absolute importance of good, restorative, appropriate sleep. So, and you may be saying to yourself, well, that's all fine and dandy, but it's really hard to sleep when pain is really bad, right? Or, if I get really poor sleep, then pain is worse. And then I have a hard time sleeping. And then we're in one of those self-perpetuating feedback loops. And that's exactly right. Very often, by the time someone has come to our persistent pain program at Spine and Pain, the cycle of poor and non-restorative sleep, lots and lots of pain, restricted movement, pain flares, a lot of stress, mood changes, and decreased functional ability because of pain has been going on for a long, long time. And it can feel very daunting and very hopeless with where to start. I usually start within this whole program, I usually start with sleep and stress, because it's pretty typical for somebody to tell me, what sleep, or lousy sleep, or I sleep in 2-hour chunks, or maybe I go 3 days without sleeping at all, or I sleep on the couch for a while, or I don't remember the last time I got good sleep, okay? So that is certainly a concern. We start with sleep and we start with stress. So we know that sleep deprivation is not good for our health. There are a number of different studies. We've been studying the science of sleep, obviously, for a long time, many, many years. What we are particularly curious about is the deeper sleep, so stage 4 and REM sleep. We know that having decreased amounts of those 2 cycles in particular are associated with increased sensitivity for pain, increased tenderness of the musculoskeletal system, reduced pain tolerance, and reduced effectiveness of pain medication, all with sleep deprivation. We also know that interruption or difficulty with stage 4 or REM sleep is associated with cognitive dysfunction. And what many of us who work also in the area of PTSD or trauma, what we're aware of is that interrupted or poor sleep is associated with maintenance of PTSD symptoms. We think that what happens during REM sleep with rapid eye movement, that bilateral eye movement, and also deeper sleep, is that important learning that has occurred during the day is really laid down and reinforced during those sleep cycles. So again, we have phrases in our language that reflect this, don't we? Have you ever had a family member or a friend tell you you're trying to make a decision, you're trying to solve a problem, you're really struggling? What's the usual advice? Go sleep on it, just sleep on it and let me know. There's absolute scientific truth that in fact that is true. One of the processes that goes on while we're sleeping is that we are laying down important learning and connecting that to other memories in our system. But what's also happening physiologically is that the processes of flushing all of the cellular debris out of the brain, by the way, all of the endocrine system, flushing the tissues, being able to have tissue healing and repair is happening while we're sleeping, okay? And it has a lot to do with pain. So this is just an illustration of a typical sleep cycle if someone's sleep architecture is going pretty well. Now, the inevitable question might be, well, how much sleep do you need really? Are you really supposed to get 8 hours? You know, different people have different needs, and sleep needs change throughout the lifespan. We know certainly that infants and babies need a tremendous amount of sleep. Why? Because they are literally creating and growing and connecting their brains, and they're doubling their size, they're learning, they're growing. That takes a tremendous amount of metabolic energy and a lot of sleep. Or in my house, if you look at puppies, they're awake, going 100 miles an hour, and then they're asleep. And then you look at them the next day and they've doubled in size. So, and different sleep needs, especially for adolescents, adolescents need a lot more sleep than older adults do, certainly. So there's some differences in developmental stage and how much sleep we need, and there are individual differences as well. A rule of thumb that I have read and heard and used myself, and when I was working with counseling students, masters in counseling students, who again are busy people, they would hate to hear this, but here's a test for how you know if you're getting enough sleep or you're sleep deprived. Ready? Are you able to wake up in the morning feeling reasonably refreshed without an alarm? If you are, you're probably getting enough sleep, especially if you feel like you have enough energy to do tasks during the day and you don't notice major difficulty in concentration. If you are not waking up feeling refreshed, you need an alarm to wake up, it's really hard to get up, chances are you're not getting restful sleep. Different things can cause that. But if we look at how sleep architecture goes, and one of the advantages is if you have a Fitbit or some other sort of, personal tracker on your phone, or anything like that, you're able to see some of your sleep architecture, and it can even suggest for you based on your movements, your restlessness, how your sleep is doing. I'm not entirely sure, quite frankly, how accurate those things are, but at least it gives an idea of restlessness and heart rate and oxygen during sleep. But usually what will happen if things are going well is that we will drop off into sleep. We actually go into REM, or rapid eye movement sleep, fairly quickly. And then we go down into deeper sleep, where we will spend hopefully some good time in that deeper, restorative, brain nourishing, replenishing sleep that we absolutely need to have. And we'll cycle through in a fairly predictable way. So there certainly are parts of our sleeping pattern where we're more likely to be awoken or interrupted if there's some ambient noise or disturbance, and then we go down. So this 8-hour template just kind of gives us a sense of what a good amount of appropriate sleep cycles will be. if life is going pretty well for us. When I talk with people about how much sleep they're getting, it's not even necessarily the number of hours, but it's also how quickly are they able to go back to initiate sleep or to fall asleep. If they do wake up during the night, what is it that is waking them up? Are they able to get back to sleep? And then what is the sense of feeling refreshed or not in the morning? Okay. So things that contribute to poor sleep. Again, this would be something that I would cover regardless of pain. We absolutely know that pain and discomfort will contribute to poor sleep, either by interrupting sleep and waking us up, making it very, very difficult to go back to sleep because of pain and discomfort, in some cases waking us out of sleep, in some cases preventing us going to sleep. And we absolutely know that. But these are overall general things that can also mess up our sleep. Environmental factors is actually a pretty big piece of it. So lights, whether that's street lights, having lamps on, your partner comes into the room and turns the light on. And yes, it's also looking at the lights from your devices. Tablets, computers, laptops, phones. Really good research evidence now suggests turn all of those things off at least a couple of hours before you want to initiate sleep. Our brains are fairly sophisticated, but our brains have evolved for a very, very long time without those kinds of artificial lights around us. And so introducing them is screwing up our circadian rhythms, quite frankly. And I also don't want to be too alarmist about that. I've had other people say, if I don't have the TV on or if I don't have a nightlight on, I can't actually go to sleep. So there's some individual variants. And it was actually fairly humorous. I was reading some articles a while ago that when street lights went from being actual lights that had to be, candles that had to be extinguished to electric street lights, there was a tremendous amount of concern in medical communities and health communities that because we were artificially extending the day, what would that do to our brains? But in fact, our brains are heavily dependent on the fact that we are diurnal for the most part, unless we have an unusual work schedule or the typical work schedule that first responders and nurses and doctors have, and police officers too. For the most part, we're diurnal. In other words, we are most alert and active and awake during the daylight hours, and we're going to be most tired and sleepy in the twilight and nighttime hours. Okay, so things that artificially interrupt that mess up our sleep. So light. Noise. If we live in a place that's noisy because of other people, if we live in an apartment, if we are hearing traffic, whatever's going on in the household, noises can certainly interrupt the quality of our sleep. And temperature. Really good research evidence suggests, again, that the best temperature for good quality of sleep is a cool one, not necessarily a cold one. But cooler temperatures, even if that means we need to bundle up and add a blanket, we tend to metabolically do better with cooler temperatures when we're sleeping. Have you ever had the experience of during the summer when it's really hot and sleep becomes more restless? That's a big part of that. Disruption of our regular circadian rhythm. So if you've had jet lag or you've traveled across time zones, and you're disrupted from what you're used to, that can take some readjustment to do that. Again, shift work. So people who are going between, working split shifts to working nights to working mornings and going back, that's actually one of the most disruptive schedules or sleep patterns possible for our sleep and our poor brains. And of course, it's what we have frequently first responders doing, some factory workers, police officers, etc. So it's extremely hard on the sleep-wake cycle to be able to switch back and forth between nights and days and splits. And of course, if you've had babies, you're well aware of the extent to which sleep deprivation is a factor of life, and how that can affect you during the first year or two. Cognitive emotional hyperarousal, which is a really fancy phrase to say your thoughts and your feelings are keeping you up and keeping you in an agitated state. Ineffective coping strategies for stress. And in some cases, what that is misplaced thinking about stress or trying to problem solve stress at night because we haven't done it sooner during the day, and we're lying, in bed at night, and then we're thinking about stressful things, trying to problem solve, and then trying to figure out, okay, what do we need to get done the next day? That can do it for sure. Or that can happen if we are woken up in the middle of the night to let the dog out, to go to the bathroom, pain, and then we're going back to sleep and we realize our mind is just churning along. If we have a tendency toward rumination meaning frequent worrisome thoughts that are pretty intrusive and keep going, and we have a hard time interrupting that and slowing that down, and what we do, of course, is we borrow our worry time from our sleeping time. Okay. Anxiety as a feeling, but anxiety disorders. So fears, phobias, panic attack, agoraphobia, post-traumatic stress disorder, all of those anxiety disorders often will come with interrupted sleep, which of course is really challenging because poor sleep also makes those things worse. Depression, again, not depressed feelings, but major depressive disorder, or what we call clinical depression. Very often that will come with, in fact, one of the symptoms is disrupted sleep, either oversleeping all of the time and not ever wanting to get up and get out of bed, or undersleeping. Now, some of that can be situational in response to stress, and then once the stressor has passed, our sleeping will go back to what it was. It's not at all uncommon in situations of grief, bereavement, or loss that will be undersleeping or oversleeping. And again, we expect those things to change over time. If they're not changing over time, though, we can become conditioned to be poor sleepers. All of these different elements, if we have a room with an uncomfortable bed that's too noisy, too loud, too warm, we have a rambunctious bed partner or a snoring bed partner, something like that, and we go to bed and then that becomes our worry time, very quickly we can condition ourselves to be poor sleepers. That's the difficult news. The good news is there are a lot of things with each one of those things that I've mentioned that we can do to recondition ourselves to be good sleepers. Sleep apnea, especially untreated sleep apnea, will contribute to poor sleep. We will be waking up and gasping for air, or waking up in the morning exhausted. And so sleep apnea certainly can be responsible for poor sleep. It also makes pain worse. It's also a health risk and needs appropriate medical attention if that might be a possibility for you. And then restless leg syndrome, where we're waking up because of those restless legs. Those are some of the factors contributing to poor sleep, certainly not all, but those are many of the usual suspects that we become curious about if we're working with you on your sleep. So what do we do about it? What helps? First, and again, these are general helpful cornerstones of good, healthy sleep for all people. Not necessarily just those in pain. However, daytime physical activity and exercise is one of the best ways that we know to regulate sleep-wake cycles and also regulate mood. Part of it is the exposure to sunlight. Again, because we have evolved as diurnal creatures, we feel more awake and alert when actual natural daylight or sunlight enters our eyes, hits the pineal gland in the brain, and helps set the sleep-wake cycle, helps set all of the other metabolic activity that tells our bodies, okay, it's time to wake up and become more alert. So Daytime physical movement and activity, actually outside, being exposed to natural light, not the inside fluorescent lights, is absolutely essential. So if this is not something that's part of your life, you might see what exercise will do for you. However, it's also really best not to do vigorous exercise within a couple of hours of when you're hoping to go to sleep. We really want metabolic activity to be slowing down before we're going to sleep. So that means not doing a vigorous workout right before bedtime. Exposure to sunlight is absolutely essential. Having a bedtime ritual. If you have a child, you know that the importance of the bedtime ritual. What do we usually say? Okay, it's time to put on your jammies and brush your teeth, and we'll go in and we'll read a book. These are all cues for children that it's time to go in and go to sleep. And the same rituals work for us too. Remember that we are in fact creatures of habit, and we are very conditioned. Most of us have a nighttime routine, hopefully. Most of us have a routine that we just do in the morning. If you don't have a nighttime routine and you're having trouble with sleep, it's time to develop one. What can be part of your nighttime routine? This is really where, again, I want to trot out a lot of the Sims. Shutting the screens down, first of all, and taking time to do something pleasant and relaxing, whatever that means for you. Does that mean a warm bath and candlelight? Does that mean reading a book? For many people, it is prayer or meditation, quiet conversation with their partner, listening to music, doing some breathing, smelling some lavender oil, howling at the moon. All of these are wonderful things. But pick a few things if you don't have a routine and do them consistently. Do them consistently. We are primed for those routines pretty habitually. But have a bedtime ritual, and have one that is using your Sims, okay? Regulation of body temperature. So making sure, again, that we haven't exercised, that we haven't eaten a whole bunch. If you do take a bath, making sure, I don't know that you would take a freezing cold bath, but not taking a really, really hot bath. Again, we want body temperature and overall metabolic activity to be slowing down. Having a regular sleep schedule. This is one of the most important pieces, and it's one of the hardest to do, but it's essential. And when I finally made this change in my life, whatever imbalances or irregularities with sleep that I was having stopped. And I will tell you that for much of my earlier life, so childhood, adolescence, young adulthood, I had significant difficulty sleeping for a number of different reasons. But so I'm not, coming to you from the land of I've always been an easy sleeper and isn't this great, and I'm going to share these tips with you. No, I come to you from the land of having had years of profound disrupted sleep, difficulty going to sleep, difficulty staying asleep, wandering around trying to sleep at night, and a lot of agitation about going to sleep. And these are the things that helped me. So, and I didn't come up with these things. These are all really good pieces of good clinical research. But a regular sleep schedule. So what does that mean? That means no matter what day it is, whether it's a work day or a day off or a vacation day, or if you're retired, every day, absolutely keeping a very consistent bedtime and a very consistent wake time in the morning, no matter what. Now, is it challenging maybe to get up at 5 a.m. on a day off or on a vacation day, if that's what you do during the work week? Sure, maybe. But again, what we're looking for is consistency. We're training the body consistently. This is the time that I'm tired. I'm going to respond to those tired signals and go to bed. This is the time that I'm going to wake up, and I'm going to respond to that and wake up. The more consistent we are, the better. Now, if you have no difficulty going to sleep or staying asleep, then you probably can skip this portion of the talk, and you may not want to have as regular of a sleep schedule, okay? But the whole idea, especially for overworked, overstressed, overcommitted people in this country who work outside of the home a whole bunch, they come home and work in the home, they are trying to manage perhaps children, perhaps older parents and family members, and trying to do all of those tasks, we might think, what? Well, I don't get very much sleep during the week, but that's okay. I'll make up for it on the weekend. Wrong. It's not how it works. There's really good evidence now that even trying to make up for a sleep deficit a couple of days a week does not make up for short sleeping during the week, not physically, not emotionally. Okay? So have a regular sleep schedule, no matter what. And when you notice that you're sleepy, instead of pushing past that to stay up and watch the news or go down an internet rabbit hole, go to sleep, see what happens, okay? We talked a whole bunch in the stress class about neurophysiological quieting, but really, truly, meditation, mindfulness meditation, guided imagery, listening to something online, the Calm app, other free apps on your phone. I think there's something called Sleep Stories. All of those can help us just relax. Or simply listening to music. Some people really like nature sounds, sounds of ocean waves, and then it goes off. Find something that you like, experiment with it, but use it regularly. Scheduling your worry. What we mean by that is, if you've noticed that your brain starts cataloging, okay, so tomorrow I'm going to do this, and I didn't get this done today, and I'm really worried about this. Are you going to get any sleep that night? Usually not. Are you actually going to be able to solve whatever problem that you're trying to solve? Usually not. So what can help the mind detach from the day-to-day such that we can get to sleep? Couple of things. Sometimes it can actually help to have pen and paper next to your bed or your couch or your recliner, wherever you're sleeping, to be able to write down, okay, I'm worried about these 5 things, or I'm going to make a list of what I need to get done for tomorrow so that I can let it go. If you're really worried about it and you can't let it go, what you might suggest, again, this might sound a bit goofy, but remember the power of the self-hypnotic suggestions that we make to ourselves all the time. If we really need to solve a problem tomorrow, then why not schedule a time to work on that tomorrow? I'm not going to worry about that right now because I can't really do much about it anyway. I am, however, going to take my first morning hour between 8 and 9 to really look some stuff up and make some phone calls and solve that problem then. Sometimes that works. Sometimes it doesn't work. All of these things together are more likely to be successful. Not stressing about not sleeping. How often have you been lying in bed at night, looking at the clock, looking at your watch? We now all have our phones around us, maybe, perhaps, and thinking, oh my gosh, okay, now it's 11:30, now it's 1:30. I have to get up I'm only going to get 5 hours of sleep. Now I'm only going to get 4 hours of sleep. Now I'm only, you follow me. Are you going to get to sleep if you're stressing out about not sleeping? Absolutely not. And this was one for me that I was very, very, very aware of. Oh my gosh, I'm only going to get 3 hours of sleep, and that's terrible, and I'm going to have a terrible day. I wasn't going to sleep with that anxiety. One of my favorite stories from my own past of sleep is when I was living with dear friends in graduate school, where, sleep is important, but it's not necessarily the thing that we're told to focus on. So I was very aware of not getting sleep, and I would be lying awake in bed at night, and a floor above me, one of my dear friends had this really wonderful grandfather clock. And you know what grandfather clocks do, right? They bong every hour for whatever time it is, but they also bong 15-minute increments. Gosh, that's super fun. So when you're lying in bed with the covers up and you know, I'm supposed to get to sleep, it's really good for my health and my cognition and my learning, and every 15 minutes, bong, bong, I would sit there and I would think, well, I would lie there. There goes another 15 minutes. There goes another 15 minutes. There goes another 15 minutes. I love my friends dearly, and I wanted to just stop that clock and make it stop reminding me of the time that I was losing. Here's what I learned to say instead, and this is genuinely true. Every rare once in a while for me, if I do have a night where for whatever reason, getting to sleep or staying asleep is hard, it's so stressful for me to worry about getting to sleep, right? That here's what I've learned to do instead. So this works for me. First of all, acknowledge, okay, sleep is hard tonight. Sleep is not necessarily easy tonight. That's unfortunate. I know I can get through tomorrow. I know that I can do that. It'll be okay. I might be a little tired. But what I also know, tomorrow night, I'm going to be able to go to bed early and I'm going to sleep so well. So what I start doing is I start imagining tomorrow night, it's going to be lovely. I'm going to be in the flannel PJs. I'm going to be in bed early with a book, and I'm going to go out like a light, and it's going to be great. So yeah, I have to go through tomorrow before that happens. That's okay. Two things that I'm doing there. One is I'm reminding myself of what's actually true. I'm not sleeping at the moment, and I don't need to panic about that. I'll get through tomorrow. That's not gonna, it may not be easy, but it's gonna be doable. But the next night, my sleep is gonna be great, because that's been my experience. When I'm doing that, I'm no longer stressed out about not sleeping, and the likelihood that I might be able then to slow down and drop to sleep is better. And I'm focusing on how wonderful tomorrow night is going to be, and guess what my stress response is doing if I do that versus if I'm looking at the clock or panicking because I'm not sleeping. Finally, one more thing, don't look at the clock. I had to make a rule for myself, even on vacation in hotel rooms. Remember when we used to do that? I had to make a rule for myself that nowhere in the room could there be any time device that I could see, because for some reason I would wake up to check it throughout the night. Don't do that. Get the clocks, the phones, all of it outside of your room. And that can be hard because many of us now use our phone as our alarm. It's kind of tempting to pick that thing up and scroll with it, which I don't like about that. If you do use your phone as your alarm, make sure it's turned, covered, dark, doesn't go off with the bells and the whistles with the late night texting. But if you use an old-fashioned alarm clock, cover it up, turn it around, make sure that you are not able to see it, so that you don't have that awareness. So those tips are actually really helpful. More strategies, if possible, avoid taking naps if you're having trouble getting to sleep at night. To some extent, it depends on the level of sleep deprivation and what you have going during the day. I mean, if taking a nap is the only way to avoid driving off the road, stop and take a nap. And the other thing is the conditioning about the bedroom. You really want your bedroom reserved for sleeping or for intimacy, not for anything else, not for schoolwork, work, stressful conversations about the kids, stressful conversations about finances, watching of television, watching of movies. Remember, what we want is for the bedroom to be about sleep. So here's the other rule that is a challenging one at first, but also really worked for me. We can very quickly, if we're struggling with sleep, we will go into the bedroom, and instead of conditioning ourselves to think, oh good, this is this nice, quiet, lovely place that I go to sleep, and magically I wake up 10 hours later looking and feeling as I do. We go into the room and we are conditioned to have the experience of, ugh, this is this place where I lie awake all night tossing and turning until my partner throws me out and then I don't sleep. We don't want that. So here's the rule. If you're going into your bedroom or your couch or your recliner, if you're able to drop off to sleep in what you think is roughly 20 minutes, terrific. If it's longer than 20 minutes and you're not asleep, get up, get out of the bed, get out of the bedroom, get away from that environment. Well, what do you do then? Go do a relaxing enough distractor task that you can focus on something else, but not overactivate your mind, quiet down a little bit, and then when you feel tired again, go back into the bedroom and try again. Now, if you drop off to sleep in a few minutes, great. If you're still awake after 20 minutes, you guessed it. Get up, get out of that room, and go. And I realize this is really challenging if your living situation, if your house or your apartment is incredibly small, if you're sharing it with other people, this may or may not be easy to do. In fact, some of the people that we work with are not housed, and these kinds of things are really challenging to do. And in this case, you're going to do the best that you can. But if you do have a separate sleeping space, leave it behind if you're not sleeping in it. You really want to consistently condition and associate that room with your good sleep, not with your struggle. Quit smoking. Gosh, like that is just the easiest thing to do. But couple things there. First of all, nicotine does in fact increase pain of all kinds, in addition to the other health effects that it does. And it also, of course, puts a burden on the lungs, but it disrupts sleep. And in some cases, if people use enough nicotine, they will tell me that they will wake up to have a cigarette and then go back to sleep. So smoking can be really disruptive of sleep. Limiting fluid intake before bed, that makes good sense, right? Just making sure, again, with fluid intake and also heavy eating late at night, you really want metabolic activity to be mostly slowed down. So not a lot of digestion going on, not a lot of active bladder going on, body temperature lower, okay? All of those things can interfere with sleep. The good news is there are great opportunities to improve your sleep. And then finally, certain medications can also disrupt sleep onset or quality of sleep. By the way, sympathomimetics, chemicals that mimic the action of the sympathetic nervous system, so caffeine, nicotine, coffee, tea, chocolate, all of those things. We strongly recommend that if you have any difficulty with sleep, that you avoid, eliminate, or minimize entirely sympathomimetics. Caffeine, nicotine. Some people are also very sensitive to sugar, okay? More strategies for improving your sleep. If it's a medication that is interfering with sleep, whether it's thyroid meds or ADHD meds or vitamin B, can you have them rescheduled with the collaboration of your physician or your pharmacist, please? Don't just randomly change your meds on your own, of course, but can you reschedule them such that they do not interfere with sleep? Usually that can be done. Aromatherapy, again, we are conditioned to have certain smells. I know for me, the smell of coffee in the morning is a lovely aromatherapy, and I also associate it with, I'm going to get up and get going. So if there's a nighttime smell that you really like, use it consistently. Use it consistently. Maybe in the warm bath or at night as you're in bed, doing a quieting exercise, doing a progressive muscle relaxation. Okay? These things really work together, but smells are extremely powerful from the standpoint of a SIM. A smell does not need a lot of interpretation. So the olfactory bulb and the memories that it activates are really powerful. You might remember the smell of the lemon. Losing weight. Losing weight can be helpful for sleep. It reduces the risk factor, certainly for sleep apnea, and it tends to improve sleep overall, can also improve pain to some extent. We already talked about caffeine, and limiting or avoiding alcohol. Sounds counterintuitive, perhaps. Oftentimes, if people will tell me, well, yeah, I have a glass of two or two of wine with dinner, it helps me relax and helps me go to sleep. While that may be accurate as far as it might make you drowsy and able to kind of go to sleep faster, since it is a central nervous system depressant, unfortunately, what alcohol does is it interrupts or decreases the amount of time that you're spending in deep sleep. In other words, it robs us of the deeper, most restorative stages of sleep. So even if we go to sleep faster, we're going to be more restless, sleep will be lighter and less restorative with alcohol. And then guess what? We wake up feeling less restored, more tired, more in pain. Nighttime comes, we have alcohol, and the whole cycle repeats. If you really want to have optimal sleep, limit or avoid alcohol entirely for at least 2 hours before you go to bed. And then your deeper sleep will be restored, hopefully. Okay, so I'm going to pause and have some water. By the way, if this looks like I'm drinking out of something strange, this is my water bottle. I realized that if I'm actually in person, I drink a lot more water than I've been drinking in these recordings. And then I'm wondering why I'm a little dry-mouthed as we're sitting here talking with you. So look down for a moment at your notepad and notice what questions that you have about sleep. What I'm always curious about too is how much of our kind of cultural stereotypes or messaging or narratives are also part of our messages around sleep. For example, I heard somebody tell me early on in my 20s that sleep was useless and a waste of time. I think what they said was, you can sleep when you're dead. We have a lot of cultural, family, perhaps, values instilled in us as far as, you know, first of all, what a work ethic should be, but also whether or not sleeping or sleeping too much might make us lazy or is really indulgent, right? We have different myths about sleep. It used to be really popular not that long ago to sort of brag about how little sleep that you were getting by on, or the whole phenomenon of, oh yeah, I sleep 3 hours a night and then I take a 5-minute power nap and then I'm great, as if somehow being able to bear up with sleep deprivation is a badge of honor. So notice if any of the messages of the struggle or the worry that you're having about sleeping is that piece rather than what the body actually needs and actually wants. We need much more sleep than we're getting quite typically. And when they've done studies of impairment, where they've had people drink alcohol to the point of intoxication, they've had people use cannabis to the point of intoxication, and they've had sleep deprivation going on for a couple of nights, and then they put them on closed courses and road test them. Guess who makes the most driving errors and who is the most impaired driver? You know where I'm going with this, right? Surprisingly, the fewest number of errors and the most cautious driver was the THC impaired driver. And no, I'm not suggesting that driving while using THC is a good idea. It's not. They were actually so slow and so overly cautious, not surprisingly, that they could have been a road hazard too. The alcohol impaired drivers were certainly impaired, but by far the most impaired, most dangerous drivers on that closed course were the sleep deprived drivers. Okay. All right. So enough about that. We're going to switch over and talk about dietary factors. And again, as I've said, I'm a psychologist, not a dietitian. or a nutritional expert. So if you have specific questions on your dietary needs or your endocrinology and how that might relate to pain, I would encourage you to follow up with your primary care provider or with our pharmacist / health coach here at Montana Spine and Pain if you would like to do that. We don't recommend a specific book or a specific diet. We're making very general recommendations based on research for pain and mostly inflammation. So certainly having extra weight can increase mechanical pain on joints. The relationship of weight to the force on the joint ranges to 1.5 to a 1 to 5 amount of torque depending on the nature of activity. So in other words, jogging or going up and down stairs has an increased force on joints, and excess weight can increase the force on joints beyond what they are designed to do well with. Excess weight can also increase systemic inflammation, and we've talked a lot about how inflammatory processes in excess can exacerbate pain, and then extra weight can interfere with sleep. The hard part, of course, is that if our joints hurt, if we have pain, if we've gained weight because of that, it can be hard to lose weight because moving is difficult for us. And I don't want this to be a spiral of hopelessness and sadness for you. I think sustained, appropriate, slow weight loss is what we're talking about here. And certainly I'm also well aware that people who carry extra weight have had stigmatizing and really painful experiences with some healthcare providers who might be meaning well, but are responding in ways that can feel really, really critical and really shaming and really unhelpful. Or persons who are underweight can have also similar experiences with well-meaning healthcare providers who may say things in such a way that it feels really judgmental and pretty lousy. So if that's happened to you, instead of giving up on healthcare providers in general, what I would suggest is looking around for someone that you can have a really good relationship with. Because it can be really hard to come in and say, hey, I'm concerned about my smoking, or I'm concerned about my weight, or I'm concerned about my health, if we feel like we're going to be judged, okay? So this is not about any kind of body shaming sorts of things. What we're talking about is the interaction between pain and nutrition and dietary needs. Certain diets or certain foods that increase inflammation can increase pain. Certain people are sensitive to nightshades, not all people. Certain people are also sensitive to gluten, although probably not as many as advertising would have you believe. And then briefly, a little bit of coverage about some supplements that are thought to be helpful for pain. So if we are working with eating, certainly attempting to lose weight is a multi-million-dollar industry and challenge, and I have absolutely no desire to contribute to anyone's anxiety or worry over weight or body image. In fact, if that is already a concern, I certainly don't want to add to that. If, however, weight loss or weight management is part of your overall health picture, there's a number of different ways that you can track that and look at your own progress. MyFitnessPal is a free app, and if you have a not free app on your smartphone or Fitbit, then you can also track weight there too. But like we've been talking about with tracking, for some folks, tracking progress is a sim. It's really exciting and rewarding and really motivating. For other folks, it becomes a dim. It becomes deeply stress-provoking, anxiety-provoking, and a source of self-criticism and shame. If tracking your calories, tracking your food, tracking your weight, tracking anything in this program is a dim or you're not sure, don't do it. There are different ways to measure and to experience your body as you are moving and breathing and scanning and checking in for pain, such as, you know, how does it feel to walk up and down the stairs? How are your clothes fitting, right? There are many different ways of looking at health and well-being. Health at Every Size, or HAES, is also a wonderful, wonderful program that has lots of good material and approaches to maximizing health regardless of body size, body shape, etc. And then Intuitive Eating, or Mindful Eating. This is a wonderful book. In fact, it's called Intuitive Eating. This is not a specific diet. What it is a program designed by two nutritionists who discovered that the chronic dieting cycle leads to a whole lot of negative side effects, including more weight gain, more dieting, self-criticism, self-hatred, shame, etc. And to break out of that cycle, this book says, make peace with food, free yourself from chronic dieting forever, and rediscover the pleasure of eating. So this is called Intuitive Eating. And there is mindfulness as part of that. And that can be a different way of working with food. We are not going to give you a big list of you shoulds, you shouldn'ts, okay? Inflammatory foods. Inflammation, first of all, is a really important and helpful part of the immune system. But in excess, a pro-inflammatory diet is what I would consider kind of the SAD diet, the standard American diet of overly processed foods, okay? High in saturated fat, high in omega-6 fatty acids, high in sugar, high in preservatives, low in omega-3 fatty acids. So it's also oftentimes a diet that is often about convenience or time, or about finances or about money. And I do not want to come across as in any way critical or judgmental of someone who says, you know, if I have $20 to feed myself and my 3 kids, and I can go to the grocery store and get a little bit of fresh produce, or I can go to McDonald's and everybody can get a big meal. I mean, the choice there is a really, really difficult one. So I don't want anybody to hear what I'm saying as, gosh, you know, wouldn't it be great if you never ate convenience or processed foods and everybody ate a fresh whole foods diet? Of course it would. But there is a reality here of money, the financial privilege that it takes to be able to purchase and prepare a good whole foods diet, the time that takes, the space that takes, the practice that takes, and that may or may not be possible for you right now. So I think one of the things that we want to do is look at whatever the food sources are that you are looking at consistently, how to select the healthiest options among the options that you have. And not to pick on McDonald's at all. I mean, interestingly, McDonald's, Burger King, some of those kinds of places have been pretty effortful over making changes to their menu that are more supportive of health, more salads, more fresh fruit and milk for children, right? Away from some of the things that are less healthy. So this is about wherever you are in your ability to acquire and prepare food. And again, one of the things, of course, that happened in the pandemic with the massive amounts of layoffs and the massive amounts of folks going on unemployment or who didn't have benefits at all, and food banks being really, really overused, is that choice and control over access to food and food insecurity is a very real issue. So please don't hear this as any kind of judgment toward what you are able to get a hold of and eat, if that's what's happening for you. In general, when we look at an anti-inflammatory diet, though, this is what we're hoping for is fresh, whole foods when possible. Fruits and vegetables, fresh and whole is great. if you can afford it, if you have time to prepare it, if you have a place to store it and use it up before it goes bad. The next best option with fruits and veggies is going to be frozen minimally processed. Those foods are great. Then canned, minimally processed, right? And if possible, the fewer ingredients that something has, usually the better for us it is, the fresher it is, the more of a whole food it is. So perhaps you've heard the whole adage of when you're in the grocery store, you want to go to the outside aisles because that's where the whole foods, the whole dairies, meats, seafoods, vegetables, fruits, the whole foods that we can actually recognize tend to be on those outside aisles, and it's the inside aisles that are going to have the packaged or boxed foods. And again, I think it's a balance, right? You know, you're aiming for a balance and a variety of foods, and you're hoping that much of your food is single ingredient or minimal ingredient and less processed when possible, okay? Lots and lots and lots of fruits and veggies are helpful for us, especially for inflammation. And Dr. Andrew Weil, these are his recommendations. He's been out for a long, long time. So a variety of food, fresh fruits and vegetables, and minimally processed. Dr. Patrick Davis, who wrote this wonderful blue book, recommended close to the dirt and close to the farm. And again, if you have a garden patch at home, if you have a pea patch, if you have access to fresh produce, that's wonderful. And not everybody does. But one of the things that I'm really grateful for about living in Montana and in Missoula specifically, we have a wonderful farmers market that goes in the winter, it goes spring and summer, and it's pretty affordable. And that many folks do have pea patches, garden patches, etc., and that we can hopefully come together as a community and eat good fresh stuff really well. So nightshades is a category of plants that some people have sensitivity to as far as pain. Notice I said some people. Nightshades include potatoes, tomatoes, eggplant, members of the pepper family, and the tobacco plant as well. So again, if you think that if you eat a lot of these things regularly and you're curious whether or not that is part of what is exacerbating pain, I would suggest, you know, gently experimenting with that. And by gently experimenting, I'm saying, eat less of some of these things, monitor yourself and see if it makes a difference. Even better, talk specifically to a nutritional expert about some of these things, especially if you're going to reduce or eliminate whole macro or micronutrients. We don't want people to necessarily do that without good medical advice. So gluten sensitivity or gluten intolerance is a real thing, of course. However, it is not as frequent of a thing as the advertising market would have you believe with all of the gluten-free products. Gluten-free products are now a multi-million-dollar industry, and there's just not necessarily consistent research on whether or not gluten sensitivity is as common as these products would have us believe. First of all, gluten is a protein, and it's found in wheat, rye, oats, and barley products. About 1% of the population is thought to have diagnosable celiac disease, and there are antibody tests that can test for celiac disease. Perhaps as many as 15% of our population is thought to have a sensitivity to gluten. So again, less common than the shelves at the grocery store would want us to have. However, folks who are sensitive to gluten may experience abdominal pain, headache, or increased joint pain after eating. I really encourage that if you do think or know that you have a gluten sensitivity, that you work with a qualified physician, a rheumatologist, an endocrinologist, an internal medicine specialist, in order to have that assessment and that workup. I certainly don't mean to minimize the severity of celiac disease or gluten intolerance for people who do have it. I'm also aware that with many pieces of our kind of food trends, that it's trendy and has been for a while to say, you know, we'll eliminate gluten. Gluten-free products are often extremely expensive and have other things in them that are not necessarily healthy for us. So get an evaluation for that before you are eliminating all of your gluten, just as a general rule of thumb. Finally, there are some supplements that have anecdotal reports and some mixed scientific findings and research as far as being beneficial for pain. And this is really kind of the area that Dr. Hobbs will hopefully be covering too. So I'll just put them up here for a quick final snapshot here. So omega-3 fatty acids, not the omega-6s that we talked about before as being pro-inflammatory. These are anti-inflammatory, and they're going to have, in many cases, fewer side effects than the NSAIDs and maybe as effective for pain, either in supplement form or in food form. Chondroitin sulfate and glucosamine can have properties that are anti-inflammatory and can be beneficial for osteoarthritis. Turmeric, there's been just a tremendous increase in a notice of turmeric, both as a plant and as a supplement for pain and arthritis. From what I understand in the reading that I've been doing, and if this is incorrect, I will apologize, but it seems as though turmeric that is cooked into food is more bioavailable and easier to absorb and for our bodies to use than turmeric taken as a supplement. Turmeric is often in Indian food and curries. I think that that's accurate. I mean, for the most part, hopefully if we're eating a reasonably balanced whole foods diet, we're getting a lot of these supplements. If not, supplementing our diet, of course, can be helpful and necessary. Cat's claw has been found in some mixed studies to be helpful for rheumatoid arthritis and also osteoarthritis. Here's what I would like for you to do, though, as a psychologist and just also as a person. Supplements can be very expensive and they can interfere with each other. They can interfere with some medications. So before adding a supplement to your nutritional regime, you want to talk to a healthcare provider about that. You want to talk to your physician, your pharmacist, or someone who knows a whole lot more about that. Because too, supplements are not necessarily as carefully regulated as things within the pharmaceutical industry. So there have been studies that have shown that certain supplements contain less of what they were supposed to contain or contain other things. So there's some variance in quality of the supplements, but they can also interfere with one another too. So when you add in a supplement or you want to add in some supplements for pain, make sure to talk about it with somebody who's qualified to have that conversation. And then just let your physicians know if you are taking vitamins and supplements too. Okay, and here we are at our functional goal planning. How are you doing with your functional goals? And how did you do with your SIMS search from last time? We were looking for things that you think and believe that are SIMS for you. Did you find two? And for next week, places that you go that are SIMS, absolutely, places that you go that are wonderful, relaxing, reassuring, restorative, that make you really happy to be there. I always love walking into Butterfly Herbs and smelling butterfly herbs, or walking up the Rattlesnake. Those are two of mine. But for you for next week, think about places that you go that are SIMS, and really be curious about all of the different places that you go. Is your home a SIM? Is your bedroom, because we spent so much time today talking about sleep, is that a SIM for you? And if not, what can be changed about that? Is your yard, if you have a yard, is that a sim for you? Is your workplace, is your car, all of these different places that we are in every day. There are a lot of opportunities to really hopefully boost our sims. And as always, I leave you with a cartoon. This is probably the only cartoon that I could find about food. And poor Godzilla has a desire, as many people did in the last year, to move away from the city and move to the country. So thank you so much for being here. I wish you happy eating and good restful sleep, and I'll see you next time.